So my name is David Stewart, and I work at 5016 Street, and I'm presenting this on behalf of my colleagues there, including Marta Pafito sitting here at the front. I'm a little slow at getting my slides up, sorry, because I'm wearing the wrong glasses, mainly. We're a busy clinic, 5016 Street. We have about 11,000 people come through our doors each month. 7,000 of them are MSM, and approximately 3,000 of those per month are using recreational drugs in a sexual context. We were aware of it anecdotally a few years ago, but weren't doing anything robustly about it. We do also dispense quite a lot of PEPs. We noticed about in 2012 that approximately 60 to 80% of the PEP presentations or prescriptions we were handing out were associated with ChemSex as we're calling it here in Barcelona. Were associated with ChemSex, and very little was being done in regard to assessing the risk or following it up or referring to behaviour change or monitoring it, really. So the first thing we have our Dean Street Express service where you can walk in, assess yourself on the screens such as this. So the first thing we needed to do was identify those who were engaging in ChemSex. We did it by just simply adding a question onto the screens. None of these 3,000-ish coming to our clinic every month were coming for support with drug problems. They were just coming with the consequences of having used drugs. That might be gonorrhea, wanting HIV tests, HIV infections, hepatitis C tests, all the usual things, but they weren't coming for support. So really it was about supporting our frontline staff in how to identify it, provide the right kind of care, and suggest behaviour change support in the right way so it wasn't unwelcomed. How did we do this? Well, I guess it really began by, once we identified it, it was really about altering the performance and asking make sure the questions we're asking and assessing the risk was appropriate. Mostly, it was these three drugs that were causing it. So ChemSex can be defined in a number of ways. We're using different drugs, different populations, but MSM using these three particular drugs, which are very powerful sexual disinhibitors, are the main drivers of the harms behind ChemSex. So we're assessing the frequency with which drugs were being used. Is it happening every weekend? Is it happening every month? The number of partners that were happening per episode. Traditionally, our performers had asked how many partners in the last 3 months. The majority of our patients couldn't identify that. So we're just asking how many in the last episode. Prevalence of condomless sex per drug-using episode. It was very different when they were having sober sex from when they were using drugs. And it was being sorted by HIV-positive people using condoms, HIV-negative people using condoms, and HIV-positive people who were on treatment. Most of the people coming to our clinic who are on treatment and HIV-positive successfully maintain undetectable viral loads, despite the sometimes chaotic use of drugs, which is surprising for us. Happy surprise. The route of drug administration. The likelihood of traumatic sex, how long was it going on for, how many partners, fisting, toys, longer fucking sessions, basically. And we had some very high alerts that we were looking out for, which was seroconversion symptoms, those, as I mentioned, who are HIV positive but not on treatment. Poor antiretroviral adherence, and the number of PEP presentations, many PEP presentations. In fact, we found that most of our HIV negative guys were had sometimes 6 or 7 PEPs throughout a year, so they're quite almost constantly protected from HIV. Frequent gum infections, frequent overdoses linked to possible drug interactions. Particularly, we're worried about GHB or GBL, where we haven't got any research yet, but the 3 overdoses from GBL occur every single weekend. They're the ones we know about, to St. Thomas's Hospital, and we don't know if it's because they're taking too much of the drug or if it's interacting with their HIV medicine, so we need to find that out. Obviously, hepatitis C is a very important one here, and there's more and more people injecting. In fact, there are more gay men injecting drugs now than ever before in recorded history in the UK. Checking the sharing of drug use equipment and the skills and harm reduction information these patients have about injecting, because they're traditionally an injecting naive population. So the results are broken down more accurately in the poster, which is out in the poster hall for you. But of the 3,000 that are coming through our doors each month, only 100 identify a problem that they want to discuss. So many of them are just coming for the consequences, saying, no, I don't have a drug problem, don't ask me any more questions, I'm off. But 100 a month are coming forward to get some support. We're finding that multiple partners, typically between 5 and 15 partners per drug-using episode. multiple PEP presentations, an average between 3 and 7 PEPs in the course of the previous year amongst our HIV negative cohort. Poor condom use is common. It's almost zero in nearly all of our patients that are on drugs. Very, very few people manage to use condoms consistently. Surprisingly, as I mentioned, our HIV positive cohort on treatment are very good at antiretroviral adherence. I think that's just because we, as a sector, have done a great job at drumming it into them. It was a surprise, but it's a very happy surprise to know that the HIV positive people that are engaging in ChemSex are pretty much protected from transmitting HIV. And very little experience of sober sex. Very few of our patients can remember the last time they had sober sex. Well, the main things we're concerned about really is that if an HIV negative guy becomes infected, say 5 weeks ago with HIV, comes to us for a test, he gets a negative result because of the window, he goes, yay, he goes off to a ChemSex party, has sex with a number of people. From our information, he's more likely to use condoms with somebody who's known to be HIV positive, but he won't use condoms, or is less likely to, with the HIV negative people he's playing with. So he could pass the infection on to them, and they all go on. So we're concerned about these clusters of very new infections amongst the ChemSex cohort. That's it, and I'm done anyway. Thank you.